Good morning. Hope you're having a good start to your day. And welcome to Question and Answer Friday. And good morning, Kim. How are you? Appreciate you coming on. Say hello to a few folks here and then we'll get going. Nice to have you guys on with us. Here we go. People are coming on. Andrea, good morning. Wendy, Ted and Wendy. Okay, Jeanette from our staff. John, Manitoulin Island. Nativity. Jerry, what about those halves? Nellie, good morning. Susan, nice to have you guys on this morning. Okay, happy Friday, yeah. TGIF. Carrie from Nebraska. And Tina from Harrow. And Natalie from Oshawa. And Inga, good morning to you. We appreciate it. Thank you very much for coming on and joining us here. Colleen and Donna. It's nice. Okay, a few more, then we'll get going. Jordan from Tennessee. Nice to have you on. Susan from Florida. Okay. Canada, United States, and anyone from anywhere else other than North America? Good morning. Zian, bonjour. Andrea. Joe, 5:30 in the morning in Duncan, BC. Early riser. Marie, good morning. And Janelle, how are you? Nice to have you on. Okay. We're going to answer questions, okay? And from Edmonton, 6:30 in the morning. Good morning, Annette and Diane and Faye. Okay, here we go. Let's go, and then I'll come on afterwards and say to the rest of you, okay, can the reset reverse hardening of the arteries? April is asking that question. Well, look, there's a lot of factors there. When you get hardening of the arteries, okay, atherosclerosis, you got to sort of undo and go backwards and what caused hardening of the artery. Now, part of that is aging, okay, part of it. And what ages us? One of the things that ages us is called free radical damage. No matter who you are or what you do, you're going to get some of those free radicals. Oxidative damage. It's part of life, right? And look, you minimize that. And this is why we emphasize a good diet, good nutrition, vitamin E, exercise. All of these things help. Can you reverse hardening the arteries? Sometimes, okay? And here's where I've seen it. I've seen it with carotid arteries. And I think I might have talked to you about this a few weeks ago, that I've seen it happen where carotid arteries were 98% blocked, for example. They do the reset. I usually put them on vitamin D with vitamin K2. Remember what K2 does, okay? So when you eat cheese and butter, the highest sources of vitamin K2, what does K2 do? Unlike K1, K1 is mostly found in the plant kingdom. What does K2 do? It takes calcium out of your arteries and puts it into the bones where it belongs. And you can see how in nature, see how God operates? In nature, when you eat cheese, for example, especially like cheese curds have the highest source of vitamin K2, you're getting calcium. Everybody knows that, right? Dairy has a fair amount of calcium. But dairy is given a vitamin, vitamin K2, to take your calcium, not to keep it in your blood vessels so that it hardens your arteries, but puts it in your bones where it belongs. That's really important. And so again, when you talk to vegans or whatever, and you know what, you don't need dairy or whatever. Look, you know me, I'm not big on grocery store milk. I like the cow in the backyard milk. That's why I prefer cream. But I'm big on dairy. I'm big on butter. I'm big on cheese. It's very important food. And you know, when you just dismiss it, and some people, I get it. You have an allergy to all dairy. Most people don't. They have an allergy to the sweetened dairy. What do I mean by that? Is that when you go to the grocery store and get your milk, you know, it's almost, well, you know what I call it? White Pepsi. Why do I call it that? Because they take the fat out of milk. Fat is, you need the fat in dairy. Skim is craziness. It's craziness. And now it's sweet. We drink more milk in Canada per capita than I think anywhere else in the world. And we got more osteoporosis per capita than anywhere else in the world. So it's not like we're not getting calcium, but we're not getting vitamin K2 to bring that calcium and put it where it belongs. So, if you want to reverse hardening of the arteries, you might not reverse it depending on how old you are or whatever to 100%, but you're going to make it better. Do the reset. I've got some statistics. I'd have to go find it. Study done on pine bark and reversing atherosclerosis. That's why we love Navitol, pine bark extract. It's sort of the, you know, people don't talk about it so much, and they don't realize how good that stuff is. And I have it somewhere. Anyway, I'll bring it to you next week because I gotta go look for it. If I go look for it, I'm not gonna get I won't get done today. Okay? Charlene, what would cause extremely cracked heels? Well, look, when you have real dry skin, one of the things with dry skin, okay, can be your thyroid. If it's very localized to your heels, it can be a fungus that's sitting there. You know, people think of fungus, they only think of their toenails. But a lot of times that dryness and cracking is fungal. It's a fungal base. And, you know, like sweating and whatever. But the other thing is it can be a sign that your insulin is too high. You have insulin resistance. One of the things that shows up is skin. Very dry skin. And watch your insulin. Could be a sign to Charlene of the thyroid. You know, we talked about thyroid distress syndrome, where the thyroid, you don't pick it up on routine blood tests, but you have all the signs, and that can be, because someone was asking, who was asking about their nails? Well, somebody was asking, hold on here. Let me see if I can get it. Well, they were asking, how come my nails, I'm taking collagen every day, and oh yeah, it's Lori. I take 4 tablespoons of collagen, but my nails are still weak. Well, that could be your thyroid, Lori. Like collagen, I love. That's why I love bone broth. Bone broth is collagen protein. It's my favorite protein. If you're going to, you know, I like it. You know, 99.9% of the people can take, a lot of people can't take whey and it bothers them. And I don't like vegetable proteins, like a pea protein or whatever. I don't like that stuff. It's not complete. But bone broth is complete. And a lot of people hair, nails, their skin, collagen, their gut because of the L-glutamine that's in bone broth. They really find it helps their gut, and we like that. But, you know, sometimes the nails are still brittle. Could be the thyroid. Could be the thyroid. The thyroid might not be up to snuff. Now, somebody else, I think it's Susie, asking the questions on thyroid, so let me get to it right now. Dr. Martin, you mentioned thyroid distress syndrome, but you didn't tell us what to take. Our thyroid formula. No, but you see, there's a few things that, because, and what I did in the teaching is that you have involved in your thyroid, you have your, remember now, okay? Again, just a little review so that you won't forget it. 2 main centers in the brain. What are they? Hypothalamus, think of hormones. Your thyroid, your adrenals, your ovaries. Okay, you got all that? Men, your testes. And your hippocampus, memory center. 2 main centers in the brain. Okay, hypothalamus, hippocampus. In the thyroid, it is regulated by the hypothalamus. It sends signals to the pituitary, and the pituitary sends signals to the thyroid gland to produce thyroid hormones, okay? There's a lot of things that can get messed up there in that transaction from the brain to the thyroid. And then on the opposite end, you have, especially in women, a condition called estrogen dominance. You're too much of a woman, even postmenopausal. Because remember, it's always estrogen and progesterone that need to be balanced. If that goes out of balance, and it happens so frequently in this day and age because people are eating soy, those fake hamburgers. When I see Beyond Meat or whatever they call that. When I see that stuff in the grocery store, you have to come and tackle me. Because I'm having a conniption. I want to scream in the grocery store. Would you get this garbage out of the grocery store? Because that's all it is. It's cancer waiting to happen when you eat that stuff. Because you're elevating your estrogen. It's always soy-based. It's full of protein. Yeah, but it's soy. And soy oils and all that elevates your estrogen. So ladies, you're a sitting duck when you eat that stuff. Don't eat it. Don't touch it. You got enough estrogen with all the chemicals, every chemical. You can't pronounce the name of it. It is, your body thinks that's estrogen because there are xenoestrogens. We live in a world that's is 100% different than the world that, our forefathers lived in. I mean, we've made a lot of advances, but oh boy, we got a lot of chemicals in our bodies, you got to protect yourself from that. Now, I don't know why. Oh yeah. She said, what do we take for thyroid distress syndrome? Well, look, again, your thyroid itself doesn't work properly without 2 things. 1, iodine. Your thyroid needs iodine. It's not in the soil anymore. And people who stay away from eating eggs, meat, and cheese don't get enough iodine in their diets. And we see that. That's why it's one of the reasons we see so much thyroid. Too much estrogen, not enough iodine in the soil, and not enough selenium. Selenium is very important for the thyroid. Guess how you get selenium? Eggs, meat, and cheese. It's found in the animal kingdom. There's very little of it in the plant kingdom. So don't live on plants. I didn't say you couldn't eat them, just don't live on them. Okay? Diane, is lamb as good as steak? Well, not tasting, but it is as good as steak. Lamb is a very, very high source of B12. Okay? And you guys know me, vitamin S. Lamb is excellent. It is really good for you, okay? I just like steak better, okay? Liver's really good too, but I like steak better. And when I like something better, you're going to hear it from me. Okay? But yeah, lamb is tremendous. It is very, very good. Okay? Very high source of B12. Okay? So, okay, Louise, what's my thoughts on fluoride? Well, I don't like it. Well, I don't. Dentists like it, but I don't. Okay, so when there's fluoride in the water system, make sure you filter your water. You don't want that. That fluoride kills your good bacteria, even in your mouth. So if you can, find a toothpaste even that you're using. I use a non-fluoride toothpaste. Okay? It's a chemical. Are you going to get away from it completely? Probably not. But, even, me on drinking water. I'm big on drinking water. But if you're going to drink out of the tap, you make sure you filter that water. Filter that water. And add a little bit of salt to your water. If you're drinking tap water, you want to make it more alkaline, that water, and you need minerals. That's why I like mineral water. Okay. Does exercise help for low dualistic blood pressure? Well, vitamin E helps just about, Sophie, everything. Again, when you look at that low blood pressure, I'm always suspicious of the thyroid. It's sluggish. It's not up to snuff. So yes, vitamin E is always good. You can't go wrong with vitamin E, okay? Exercise. You just can't. And again, I reiterate my liking of exercise. What do I like the best? Ladies especially, make yourself strong. Make yourself strong. And you don't make yourself strong by walking. Now, walking's good. I love walking. I'm a walker. Okay, I like it. But you don't make yourself strong, ladies. Don't fool yourself. Cardio. Nah. And especially as you get older, cardio is not near as important. Your heart gets a good workout when you keep it short and strong. So what do I recommend? 3 to 4 times weekly, 15 to 20 minutes. Get the bands out. Weights, and get yourself strong. Get your legs strong. Okay? Really important. And I'm just making some notes here because I thought of something for next week. What causes calcium deposits on the eyelids and in the lungs? Well, again, I bring you back to where calcium belongs. Calcium don't belong on your eyelids, and calcium does not belong in your lungs. You're calcifying things. Again, it's usually a lack of vitamin K2. And some people are more susceptible than others, but vitamin K too. And I've had doctors tell me, well, you're taking too much vitamin D. And no, it's not that. You're taking vitamin D, in a supplement, and I like putting K2 in it. Okay, somebody asked me a question, and maybe I'll bring it out. Okay, Dorothy, and then I'll go back. Dorothy, concerned about her vitamin D and her B12 are too high. Well, USA numbers, you are a little bit high. Well, then stop taking it and just get in the sun. When you take a supplement and your serum levels of vitamin D are too high, you got another problem. Okay? It's not because you're taking too much vitamin D. It's because your body is absorbing it. And usually that is a problem. It's twofold. Can be one or the other or both. And you know what it is? Kidneys. Because you're on medications. Certain medications might do that to you. Kidneys are not filtering it out properly. And liver. Kidneys, liver. Look at those two things. If your numbers of serum level, so you got 120 USA, so that would be about 300, in the range of 300, a little higher in Canada. What happens if your vitamin D is too high? I'm waiting. It's not like I'm in the emergency department and I know why I'm here. I'm very unwell. Oh, my vitamin D is too high or my B12 is too high. Now, B12 is a water-soluble vitamin, but remember just a little teaching on vitamin D. It's fat-soluble. That doesn't make it dangerous, guys. That comes out of, 100-year-old thinking. Because all they ever saw, and I talked about this yesterday, is vitamin D being for your bones. Oh, it's too high. What happens? Are you going to croak? Are you going to be in the emergency department because your vitamin D is too high? Oh, it can give you kidney stones. Nah, here's what I find with kidney stones. You're on too much sugar. That's kidney stones. And B12's water soluble. I want your B12 to be high. Now, if it's around 1400 or whatever, well, get off of it. Just eat steak. And your body knows how much B12 you need. I like to optimize B12. I like to optimize vitamin D. But it's not like the waiting rooms are full in North America because, you're taking too much B12. No wonder you're sick. I remember having a conversation. Actually, she was one of my patients. She was a physician. And then she called me, I don't remember, about a month after whatever that I saw her in my office. But then she said, Dr. Martin, I got one of your patients here, and one of my patients, one of your patients. Her B12 is too high. And I just listened. I like to tease, you know that. She said, Dr. Martin, you still there on the phone? Yeah, I said, okay. So her B12 is high. What does that mean? Well, she said, it got flagged. It's too high. I said, I want it to be high. Oh, she said, how come? Well, you need B12. Your body doesn't work without B12. Your brain doesn't work without B12. It's water soluble. Your body will get rid of what it doesn't need. I guess this lady needs more B12. Oh, she said, I didn't know that. I said, well, what happens if your B12's too high? It's water soluble. Who cares? I don't mean to make light of it, but I don't care. You got a high B12. I might tell you to stop. You don't need a supplement anymore, but you better eat your steak to keep it up. Having high B12, what does it do? Doesn't damage your kidney, doesn't damage your liver, doesn't damage your heart, doesn't damage your brain. And by the way, that blood test for B12, it's 100 years old. We should give it a birthday party and send it to bed. Okay. Colleen's asking about pillar cysts. They're big and sore. Okay. And then somebody was asking, I think, about granuloma, Anna. So let me answer there too. Anytime you have a growth on your body, cysts, always fungal. Granuloma, remember there's two things that make things grow. Two things that make things grow. You guys should know this. What makes things grow? Estrogen and insulin. They're growth hormones. They make things grow. And you want to shrink. Lower your estrogen and lower your insulin. One is food. Lower insulin. Get off the crappy carbs. Okay? Cut out your carbs. And it'll shrink, and get your estrogen down, because estrogen is a growth hormone. It makes a woman and a man a woman too. And it loves to take tumors and make them grow. And someone was asking about, hold on here. They were asking about polyps. Where did I see that? I'm sure I did. I saw one on polyps. What makes polyps grow? Like colon polyps. A lot of times if you get a colonoscopy, the doctor will say, oh, I cut out a polyp. Well, what makes a polyp grow? You got polyps, you got too much insulin. You got a polyp, you got too much estrogen. Those are growth hormones. Okay? You got to cut them out. Cut that insulin down. That's the one you can control the most. It's food, man. Cut it out. I mentioned this to you before. This is why we see such a high rise. We're not winning the war on cancer. We're losing the war on cancer. Why are we losing the war on cancer? Because we're looking for love in all the wrong places. We're going to talk about that on Monday. I'm going to tell you a story on Monday. No, but seriously, we're losing the war, and it frustrates me because we're talking about a virus, and nobody's talking about cancer. More people died of cancer, and more people will die of cancer because we're focused on the wrong thing. And even in cancer treatment, we're focused on the wrong things. We got it upside down, guys. It drives me crazy. Okay. Oh, Judy. I like this. Some of us ladies, Judy's saying, some of us ladies don't have, what are you saying, Judy? Especially us older ones, don't have some of the female parts. I'm assuming you're talking about ovaries. And some of you, ladies, have had a complete hysterectomy. Right? You don't have parts. But two things. One, even if, because women have asked me that. okay? Because I used to be a hormone doctor. When I was in practice, I mean, my practice, it wasn't 90% women, but it was at least 80% women, I think. Yeah, really. The only time I saw a man in my office was when that big baby was dragged in by his wife. Not really, but it was 80-20, okay? And I used to, because ladies would say, well, doc, how could I have any estrogen? And I would say, you're estrogen dominant. She said, well, I've had a complete hysterectomy. I said, so what? You're still a woman. Because God gives you plan B. You're still going to make hormones. Now, you won't make as much as you did before, because if you had a total hysterectomy, you had way too much estrogen. That's how you get endometriosis. That's why you get PCOS, polycystic ovarian syndrome. But again, it comes down to two hormones. What makes things grow, ladies? Estrogen, way too much. And two, insulin. Isn't it simple? It's not that complicated. You got bad periods? Young ladies, you got too much estrogen. 100%. And one of the biggest things, one of my pet peeves, it's a pet peeve, is birth control giving them estrogen to young girls. They put them on the birth control pill because their skin is bad or they have bad periods. But they're not fixing the problem. They're masking the problem. And they usually give them estrogen. That's dangerous. It's dangerous for those young women because breast cancer is estrogen based. Okay. And Judy's saying, how do you balance those things? Well, eat well, get on our hormonal formula, our menopausal formula, or both. I have women on three things oftentimes because what I'm doing is I'm lowering their insulin, so I want their insulin down. So I put them on insulin balance. Then I put them on DIM, our hormonal formula, knock that estrogen down. And then I elevate their progesterone with the menopausal formula. Henry, what are my thoughts on the Noom diet? Yeah, you see it advertised. Well, look, it's based on, psychology of food and, you buy an app and you sort of get a coach and you pay so much a month. And I think it's about a 16-week program to sort of regenerate your brain because it's some of it is psychology and exercise and it's a healthy lifestyle and, it's low carb and they get you to think about food. And hey, look, I looked at it, I'm not against it. I'm not. But for free, I would rather you do the reset. It's better for you because it's going to do at least 15 or 16 different things in your body. It takes 30 days. You do not have to pay for it, although I would like you to buy our book. But then you join a free group, the Martin Clinic Facebook group, and you get coaching right there. And then you get a group of, and this is what apparently Noom does too. You get interaction, but we have that. So can I tell you, I put the reset up against that any day. But I'm not against it, okay? So I'm not against it. You want to put an app on your watch or your phone and you wanna deal with that, I got no problem with that. You want to do it, good for you. But I tell you, it ain't the reset. And you want to see thousands and thousands and thousands of people who have benefited from the reset. You know? And the reset is to fix insulin, primarily. And when you fix insulin resistance, I don't care. You are fixing the most important thing. You're like I talked to you all the morning about hormones and about estrogen and about insulin. And I'll tell you what the reset does. Helps your hormones. It really does. It lowers estrogen. It helps your body to balance. And it gets rid of insulin resistance in 30 days. It's gone. If you're a diabetic, it'll put you into remission. Okay? How do you like that? It'll put you into remission. Now, and if you're a diabetic or a pre, you need to be put into remission. Okay. I get pumped up. Okay, well, listen. One more. Oh, that was Frida asking about polyps. Okay, so thanks, Frida. Joan is saying, okay, two more. Joan, someone has a larger belly. Can we assume that they have a fatty liver? Yeah, you can pretty well assume it. Now listen, because she's asking the good questions. Would they have higher triglycerides? Yeah, in about 95% of the case. Sometimes triglycerides, that's the first sign. If you look at blood work, and you know me, I want to know what your lipid profile is. And what am I looking at? You guys should know this by heart. I'm looking at your triglycerides, TG, and HDL. I don't look at anything else when it comes to lipids. I don't want to know what your total cholesterol is. I don't care. I don't want to know what your LDL is. I don't care, and you can't make me care. Okay? It's not that I don't care about you, but I don't care about your LDL. I don't care. Well, my doctor said, I don't care. I don't. I care about you, so I'm telling you the truth. Now, you got a belly. That's a sign you have metabolic syndrome. That's why I created the reset. You got trouble with insulin, 100%. Now, will it show up in your triglycerides? Yeah, about 95 to 99%, that'll show up first. And if your triglycerides are high, your HDL is low. It's usually teeter-totter. So when you get your triglycerides down by doing the reset, you get your HDL up, which is the best thing you can do, not only for your heart, not only for your blood vessels, but for your brain. We're going to talk about the brain next week. Okay. And one more, Connie, do I like colloidal silver? No. No, I like it, but I don't use it. I've seen people take too much colloidal silver. No, listen, if you like it, I don't care. You can, but you see, for me in practice, and I just reiterate this, for me in practice, you have to understand where I come from. I am a guy who focuses. So when I was in practice all those years, somebody would say, Doc, I'm taking colloidal silver. What do you recommend? Oil of oregano. Because you're not going to overdose on oil of oregano. It's better, in my opinion, than colloidal silver. So if you ask me about colloidal silver, it's like saying to me, okay, and I'm a tease, you know that. Oh, Doc, what about tea? Oh, yeah, but why do you drink tea when you could drink coffee? Coffee's better for you. Colloidal silver, yeah, it's good. They use silver as a disinfectant. They use it as an antibacterial for years and years, right? That's why the king had a silver cup. Okay? They knew it was good for infection, but oil of oregano is better. That's all I'm saying. Oil of oregano is antiviral. Isn't that important? It's antiviral. It's antibacterial. It's antifungal. That's why I like it. I like it better. So I like colloidal silver. I just like it better. Okay. Wendy, do antibiotics really cause irreversible damage to our gut microbiome? Remember the other day we talked about extinction. Some species of bacteria are extinct. Okay? But listen, what we have today are broad spectrum probiotics, and you put those things that you lose back in your body. So is it irreversible if you've been on antibiotics? No, but you better stay on probiotics the rest of your life and make sure they're broad spectrum, because you can regenerate, Wendy. Very, very good question. But some people, it takes a long time to regenerate all of it. Okay? Good questions. Thank you very much. Appreciate it. Okay? I might have missed one or two, but I tried to hit most of them. Okay? So, next week, okay, Lord willing, we're going to have some great sessions. And Monday, we're going to talk about cancer. Okay? And I just want to give you a little bit of history on Monday. I think you'll find it interesting. Okay. Join the Martin Clinic Facebook group. Friends, family. Invite them. The Reset. If you don't have that book, get that book. And we love you guys. Talk to you soon.